Welcome to the Helpful Pharmacist Weekly Podcast. My name is Chris. I am a biochemist and a pharmacist. And again, I'm here today on Tuesday to talk to you about all things health related. For anyone that's joining live, please feel free to put some messages in the chat box here and I can respond to them. The goal is definitely to get personal and personalized with the information we provide, as although health can be general, it's also very personal in nature, as most of us know. And the goal of this is to be able to provide some more one-off answers we may not be able to get normally through the internet. I do have a presentation today that I'm going to go over if no one has any other questions. So let's get into that. Again, if you've been following our series here over the last 4 or 5 weeks, we're getting pretty heavy into diabetes. Again, if you've watched those videos, I've been speaking about how I think diabetes is an epidemic and how it's really getting worse. Obviously, if we look around and look at the data, we've talked about how potentially in 25 years, 1 out of every 3 Americans could be diabetic. We've talked about how there's between 35 and 40 million people who are diabetic, and as many as 9 million or 10 million who are not diagnosed but are diabetic. And also the idea that there's between 90 million and 110 million pre-diabetic patients that could potentially become diabetic in the future. So again, this is why we're talking about, to give some background. Today, we're going to have a slightly different kind of flavor here. So instead of talking about diabetes directly, we are going to be talking about complications. We did do some prior videos about that, but today we're going to focus on just a specific one and use it to also illustrate some greater examples, as I think this is a great talking point. So we're going to get into it. Today we're going to change the format slightly. I'm going to be using some slides that I share with you, so you will be able to see that and follow along. So hopefully that will provide some additional information and kind of your experience for you guys. So let's get into this. So today the topic is why cardiovascular health matters. Again, like I said, we're talking about complications of diabetes. We've talked previously about how diabetes and cardiovascular disease are very interlinked, and oftentimes it's very difficult to talk about one without the other, which is one of the reasons why we have the subject today. So before we get into that, I want to pose some questions for the audience, either people who are watching it live or watching the recording. And I think you kind of get the idea here. But we're really talking about simple things that can literally change your life. That's part of the goal with this series, is to educate and empower people and help them realize there's a lot of little things you can be doing that are very easy and simple and oftentimes subtle that may not require any extra time, energy, or even really work on your part, yet can make a life-changing benefit or difference in your life and your health. So starting off with this. So the first question is going to be, how often do you exercise 20 minutes a day or more than 20 minutes a day? Second question is going to be, how often you measure your blood pressure? Typically going to be measured at home for this question. And then the third part is going to be, how many people who are listening to this know their LDL, which is the bad form of cholesterol. This is the one we're usually talking about and worrying about. And so I've done some talks recently and I've been asking these questions. And what I've been surprisingly finding is that at best, maybe 1 out of 3 people in the audience has been reporting to do all 3 of these things. And maybe even less if you look at individual ones. And so I think that's really surprising for me. And I'm trying to take that feedback from my patient population, the community, and use it to further target this information. So kind of giving a quick spoiler alert, jumping ahead, these 3 things probably have more impact on your life, your quality of life, and your future than potentially any other things you can do or measure or be mindful of. So again, kind of the trick question here is most people are going to answer no to all of these questions. And in reality, there are very few things that you can do beyond these 3 things to have more of an impact, which again is why the title of the slide is the 3 simplest things you can do that will change your life. And hopefully by the end of this, you'll understand the kind of foundational reasons as to why these things are so important. And more importantly, hopefully it will motivate you to want to answer these questions yes next time someone asks you. So I know this is kind of a busy slide. Part of this is just for me to kind of stay organized, but the real takeaway here is we're looking at the top 10 causes of disease as found by the CDC. And what we're actually seeing is that almost all the items on the top 10 list are caused or directly impacted by cardiovascular disease. So previously, we've talked about how cardiovascular disease is a leading cause of death in the United States. And as you can see here on the slide, it is listed as number 1. There's about 700,000 deaths. But what is interesting when we look at it a little bit further is that basically every single item on the list of top 10 is all increased by cardiovascular disease. So I'm trying to kind of, again, evolve the point here that it's not even about managing our diabetes. It's not even about managing and preventing cardiovascular disease. But what I'm trying to communicate today is that in a lot of ways, from a simplified way of looking at it, cardiovascular disease is oftentimes the foundation of almost all disease. And I think the slide very much supports that point, is that when you look at it, you can literally see that every major cause of disease or death is linked to cardiovascular disease. And I think that's a really unique way of looking at it that a lot of people don't think of. And I think when I asked these questions on the prior slide about why people aren't doing things, the goal is that even just by seeing this, it is going to change their behavior. Because they may be thinking, well, I'm not worried about high blood pressure and I'm not old, so I'm not going to have a stroke. But they don't realize, as an example here, one of the layers is that it actually drives almost all the other things we're worried about. So it's not just high blood pressure we're worried about. It's things like cancer, Alzheimer's disease, cognitive disease, kidney disease, liver disease, all these things that we're worried about, we should be worried about, or we should be mindful of, they all link back to cardiovascular disease. And I think that's a unique way of presenting the material here. So just some examples. Again, if we go from number 1 to number 2, studies have found about a 10 to 25% increase in the risk of cancer for cardiovascular disease, which is, again, the number 1 cause of death. The next one we go to is number 5, which is strokes. Again, I'm personally slightly surprised this gets broken out. I think when they talk about cardiovascular disease being number 1, that's primary atherosclerosis, which is the complications of clogged arteries, which is why stroke is broken out as a second one. Again, we can intuitively understand that cardiovascular disease or high blood pressure probably definitely drives stroke. But in this case, it's actually by a factor of 2 to 5, which is significant. It's a large driving factor. We're going to jump down to number 7, which is Alzheimer's disease or cognitive disease. Again, a 20 to 50% increased risk depending on the type of cardiovascular disease you have, which is, again, significant. Number 8, diabetes. We've talked about previously that when, unfortunately, diabetic patients do pass away, more than 50% of the time, the cause of death in that case is actually due to cardiovascular disease. So that's a point we talked about before. Again, demonstrates why cardiovascular disease and diabetes are so interrelated, interlinked. You definitely can't have one without the other, oftentimes. Again, number 9 would be kidney disease. So again, we've also talked before about how the heart and the kidney are very interrelated. And unfortunately, when you have diabetes, that's also the case. Diabetes is definitely a disease that affects both the heart and the kidney, which then affects both of those together. In the case of the kidney, oftentimes it's increased concentration of sugar, which changes the way that the kidney works in a way that's harmful for the kidney. So in this case, we can see here that you can increase the risk by a factor as much as 2 to 5 for kidney disease when you have uncontrolled blood pressure, and also 30 to 50% for atherosclerosis, which again is clogged arteries typically. And then also number 9, which would be liver disease. So we can see here that as much as 50% increase on the low end to as much as 2 to 3 times increased risk on the high end. So again, we're looking at the top 10 causes of death, and we're showing that 7 of those 10 are all affected by cardiovascular disease or high blood pressure or both. And I also want to include the fact that I did leave COVID off of here because there may be, less data or less commonly understood knowledge that links the two. But definitely, if you have cardiovascular disease, if you have high blood pressure, if you have clogged arteries and you get COVID, there's definitely an increased risk of death. So you could definitely make the case that 8 of the top 10 causes of death as of 2023 are all linked to cardiovascular disease. So I think, again, that's a point that people aren't thinking about. They're just thinking about high blood pressure and they just leave it at that. Oh, it's a high number. Everything else is fine. I'm trying to illustrate here. It doesn't work like that. There's actually quite a bit of other things that are going to go into it. That are going to be affected by it. And I think the idea is that if it's not only the number 1 cause of death, but influences 9 of the other 10 causes or 7 of the other 9 causes, that's significant. That's something to be mindful of. Again, kind of driving this point home further. So studies find that about half of patients in the United States with high blood pressure don't know they have it. So again, think about that. We're asking people to measure your blood pressure and they're saying no. And then we're also looking at the idea that high blood pressure basically increases the risk factor for all the other most common causes of death. On top of that, when we look into that population further, we're finding that half the people who already have that or have a serious risk factor for that don't even know they have it. So again, we're really trying to talk about knowledge is power and how people need to be aware of what's going on. They need to be informed to make better decisions, such as measuring their blood pressure at home. And so I think this just really ties in all those points together, that the number one or a leading cause of death, half the people who have that risk factor or the cause of that, they're not even aware of it, which is just mind-boggling to me. It's number one risk factor, the number one cause of death, yet half of the people who have it don't know it. As well as when we look into patients who are diagnosed, we actually see that only 1 in 5 of them is properly controlled. So as if half of them not knowing of it wasn't bad enough, but when we look into the people who do have it, only 1 in 5 is controlled. So that potentially leaves something like 80 to 85% of the population is affected by this not being properly controlled, which again, I think is a very alarming concept. And I think it needs to be shared with people to help motivate and empower them to make these changes. And we're going to talk about what those changes are. Another thing that I want to kind of throw in here is, this has been coming at me recently, is I get a lot of questions, and a lot of them right now are about statins and people not wanting to take statins. And a common concern is statins affecting memory. So last week we talked about this, and there's a lot of evidence that shows little to no link between statin usage and memory impact. There were several studies that I reviewed. I believe one had 17,000 people in it and one had about 6,000 people in it. And in neither study did they find any correlation between the two. The reason why I'm using this as an example is that there are very few medications that are more beneficial for those who needed statins. Again, statins reduce the risk of cardiovascular disease, which obviously we just said is the number one cause of death. And so my point is that cardiovascular disease, because it does cause 1 in 5 deaths, would be a 1 in 5 chance, depending on how you look at it in terms of death. Going back a little bit further, it's probably more like a 1 in 10 chance you're going to get cardiovascular disease, something around that between 1 in 5, 1 in 10. Yet a lot of people aren't actively managing that. And my example here again is that we've shown a statin is going to significantly reduce the risk of that, like atorvastatin, simvastatin. But people aren't taking it because they're worried about memory, which we have now shown or is now understood to be more like a 1 in 1,000 risk. So my point here is that people are becoming more fixated on a 1 in 1,000 risk or chance of something bad happening versus a 1 in 5 or a 1 in 10. And I think this is a really interesting point. And again, it fits into this whole concept that if cardiovascular disease is the number one cause of death, and high blood pressure is probably the biggest defining factor of that, yet most people don't measure their blood pressure. Most people who have high blood pressure don't know it. Most of the people who are diagnosed aren't properly controlled. And a lot of the medications we have to reduce that risk even further, people don't want to take because they're afraid of a 1 in 1,000 side effect. So if you put all those things together, I think it really illustrates, at least to me, the state of awareness, education, engagement in the United States about preventable diseases, which I argue and have argued in the past, cardiovascular disease is one of them. So I think, again, that's a really powerful way of looking at it, is that a lot of people are more afraid of a 1 in 50 or a 1 in 1,000 event than a 1 in 5 or a 1 in 10 event. And I think that needs to change. And I think when people begin to understand that more intuitively, it's going to empower them to make those decisions and make those lifestyle changes that they currently aren't making. And the great example would be exercising more and measuring your blood pressure. Those are a 1 in 5, 1 in 10 chances that you're not doing, that take almost no time, no energy, no money. And part of the goal of today is to help you understand that. So I think that's really important. And like I kind of already said here, I think when you look at people's behaviors, you're not seeing this reflected, and that's part of our mission here. Again, recently I did some presentations, and less than 1/3 of the audience were doing these things, which I think is important. And again, this illustrates the power of health literacy, which is a fancy term from being able to understand and apply health information to improve your health. So again, if people are more worried about a 1 in 1,000 risk versus a 1 in 5 or 1 in 10 risk, I think, again, that demonstrates the problem. I also want to include the idea that part of why I think people are struggling with this is they don't have a why. They don't understand why. They don't understand the benefit or the need. And again, that's why we're here today. So I think, again, without the why, as soon as you come across a barrier or an issue, people tend to give up. And that's why the why is so important. And so some examples of that are following laws. We all know the why of what happens when we don't follow the law, so we do it, even though we don't maybe necessarily want to. We're paying taxes, obviously. Nobody wants to pay taxes, but most of us do it because we understand the why. Same thing with going to work. Most people probably wouldn't go to work if they had unlimited money, but they go to work because they need money. They understand the why. And same thing with paying rent. So my point is there are a lot of very tangible examples of things that nobody really wants to do, but we all do with a very high frequency of regularity because we have a why. And so again, I think what's really lacking in health and healthcare, people being proactive and preventative and all those, fancy terms, is they lack the why. They lack that understanding. And again, that's why we're here today. And I also want to include too that people don't have a reward. So if you were to tell someone you need to measure your blood pressure, why? What's in it for me? What am I going to get out of it? If you can't explain to people what the goal is or what the reward is, beyond not having a why, they're even less likely to want to do it. And if you have a goal that the reward is so far in the future, it's like, why bother? I don't want to deal with it. And then these are real issues. These are real concerns. And so we're talking about them. So I just, again, want to include some examples of rewards here along with the whys. Is the first one would be you definitely will have more energy. When you have diabetes, when you have high blood pressure, when your cardiovascular system doesn't work well, it definitely causes fatigue. You don't feel good. Same thing with the kidney. Again, that also translates into being more productive. Typically, productivity is increasing what you can accomplish, which is basically another word for saying you have a higher quality of life, you have more reset or more resources, more money, more friends, more hobby, more pleasure, whatever it may be. And again, like I'm saying, a better life lived. So who wants to be that person who's stuck on the couch for 10 or 20 years, or even worse, stuck in a bed for 10 or 20 years? I can personally tell you that I had a relative who basically lived the last 40 years of their life in a bed. And that's definitely not something I want for anybody, because I've seen firsthand what that does to them, what it does to their family, and just the overall struggle that creates for everyone around. And again, if you have a stroke, if you have a heart attack, if you get cognitive disease, almost all those things on the top 10, all of those could potentially put you in a bed for 10 or 20 years or longer. And again, we're talking about how cardiovascular disease and high blood pressure not only drives those, but is one of the easiest things to modify and prevent in our own life. So again, I just want to talk about the why and the reward because I think that's important and I think that matters. So again, we'll talk about the cardiovascular disease system for anyone who's just joining us. Again, my name is Chris. I'm the healthful pharmacist. I'm a biochemist and a pharmacist, and I'm extremely passionate about educating people so they can live better lives. We are doing a diabetes series, and today we're talking about diabetes, but more so from the lens of cardiovascular disease. One, because cardiovascular disease, again, is a leading cause of death. Two, it's very preventable, semi-unfortunately, fortunately. And three, there's some really interesting examples about people not making simple decisions that are going to improve their health that are really easy to illustrate here. So I also want to use it as a context for those points. So talk about cardiovascular system real quick. Let's just define what it is, the basics. So again, you have the heart, which is basically the engine. It pumps the blood and moves it out. You have the vessels, which basically contain the blood. And I'm going to think of those like the roads. So again, you use roads to distribute, to communicate, to transport, all that stuff. And then I'm going to use the analogy of the blood is basically like the trunk or the shopping cart. So all of the stuff, you go to the store, you buy it, you put it in the cart, you put it in the trunk, you get it in the car, you turn the engine on, you get on the freeway and you drive home. So again, kind of like the idea is that you're moving nutrients through the body. The heart does the work to push things. The vessels contain it to perform transportation. And the blood is basically everything is held or stored. Okay. So I want to make sure people understand that. We're going to give a quick little rundown of how it works just so we're on the same page. So basically, you're going to breathe in air through your nose or your mouth. It's going to go into your lungs, and your lungs gas exchange is going to occur in the alveoli. And ultimately, that gas or that oxygen is going to get into the blood. It's going to get pushed into the heart, and then it's going to get pumped out of the heart for distribution through the body. Okay. And I also want to make a quick aside here that oxygen is one of the single most important things in the human body. Oxygen is where energy comes from, and I'll give you an example of that later. So one of the primary roles that the cardiovascular system provides is transporting oxygen through the body. And every cell, every tissue, every part of the body, with almost no exception, needs oxygen. Just to kind of give a very important example. And I also want to include the analogy here that oxygen is kind of like a $20 bill on your body. It's basically good everywhere. Just like you can go anywhere, if you pull out a stack of $20 bills, people are going to smile and ask how they can help you. Oxygen is very similar in the body. It's the currency of the body. Every cell, tissue in the body wants oxygen, just like they want $20 bills. And basically, it makes everything work. So I think that's an important thing to be mindful of. We'll talk about that later. Also, again, after the heart, then we have arteries, and they go from large to small to smaller. As they get smaller, they get localized. So you have one big artery that comes off the heart, and then it forks and it forks and it forks, and it goes into little tissues. And then that allows the tissues to kind of regulate and modulate how much blood flow they need. Because the lungs, the kidney, the liver, the muscles, the skin, the tissue between the skin and the muscles, the bones, all that, they have varying levels of oxygen they need and blood they need. And so as the blood vessels fork and get smaller, it allows the body to control that. So that's the next part. And then eventually I want to include here on the smallest level, the blood vessels, which is typically called microvasculature. Again, micro being small, they can get as small as the diameter of a single blood vessel. So on the smallest level, they're that small, which again makes them very fragile and sensitive. And we've talked before about how in diabetes, it's a disease of complications, often the cardiovascular system and the nervous system. And this is a great example because those nerves, they use microvasculature to get their blood flow and their oxygen. And because those vessels are so small, they're very easy to block, very easy to occlude, very easy to damage. And again, that's why diabetics typically end up with neuropathies, is because of this correlation between these small blood vessels that feed the nerves being very fragile and very delicate. So that's another good point to make for your background. And then after the blood goes into the veins, it has to come back through the capillaries, back through the veins to get back to the heart. So obviously it's a closed loop system. It's got to go out of the heart and come back to the heart and recycle it. So again, if you have fluid that's getting built up in those tissues, doesn't return back to the heart, things will also not work well. So I think that's an important concept. And exercise also helps that. So you have lymphatic vessels or lymphatic ducts, which is another system for bringing fluid back to the heart to be recirculated. That builds up, and every time you walk or contract your muscles, it basically helps those work. So for people who are on the couch, who don't exercise, they may have basically fluid that accumulates in the extremities, and it may cause the workload on the heart to get more. Just to give you another example of how have microvasculature, fluid return, all plays a role in your health. Another crazy concept that I personally don't believe, but I looked it up so I know it to be true. We have 60,000 miles of vessels in our body. What a crazy concept. I wish I was 6 feet tall. I'm like 5'9", yet I somehow have 60,000 miles, which is, I didn't even do the math. I think that's 30 million feet. I have 30 million feet of blood vessels in my body, even though I'm 6 feet tall. Crazy concept. And I think the point that illustrates here is there's plenty of opportunity for things to go wrong. If I have one pen versus 1,000 pens and all the pens are being used, there's more likely to have a problem with 1,000 pens. So again, if we have 60 miles of vessels, there's a lot of stuff to go wrong. Again, I also just want to include here why circulation matters, because again, I think if you understand this intuitively, it allows you to make these decisions a little bit better. So we've already kind of talked about how the circulation carries all the nutrients, all the resources for the body, for all the tissues, but it also removes the waste products, which I think is important to be mindful of, is that when we don't have good circulation, things build up, they accumulate in a very unhealthy way. So that's an important concept. The first point there is that most of the nutrients in our body are going to go through the blood at one point, which means that when we have a poor diet or we consume processed foods, that's going to be concentrated in the blood vessels, which is why we see atherosclerosis, which is basically fatty streaks or plaques that build up in the arteries. And again, a big part of that is that our diet concentrates in our vessels and our blood. And then again, the vessel that holds that blood is the one that really is exposed to it. There's also high concentrations of immune system cells or proteins in the blood, and the circulation system transports those. And there's also high concentrations of free radicals, because there's a lot of things going on in the blood vessels. So I kind of have the analogy that the blood vessel in a lot of ways is the front line for human health. It is the foundation. Most things are going in and out of the blood at some point. Oftentimes they're concentrated. They can be small, they can be fragile. There's a lot going on there. The next point I want to introduce here is that cells do not do well when they don't get what they need. I think this is an intuitive thing we can all understand. When I don't eat, I don't feel good. When I don't sleep, I don't feel good. When I don't get water, I don't feel good. Cells are the same way. And like we were just saying, the circulation is where all their nutrients come from and where all the waste products are removed from. And so again, we can start to understand that when that doesn't happen correctly, the cells are going to suffer. I think that's an important analogy. Again, taking a step back, talking about the heart now, the heart works 24/7, doesn't stop. So if you thought working 40 hours a week was a tough job and was tiring, imagine working 24/7. I think that's a really powerful concept that people understand, is not only is this cardiovascular system where all the resources occur, all the transportation occurs, and it's very sensitive and fragile and everything relies on it, but it's also working 24/7. There's not a lot of things that work 24/7 without exception. The example here too, to drive that point home a little bit further, is that on average, the heart beats about 100,000 times a day, which again is a pretty staggering number. I had to double check the math there, but 100,000 beats a day. So again, trying to make an analogy here, a common theme in wellness, which I support, by the way, is increasing your steps and counting your steps. Oftentimes 10,000 steps is a good goal. Again, obviously we're not going to compare steps to heartbeats, but again, if 10,000 is a good number for one, we're talking about 100,000 here. So it's 10 times more over what's already a goal. Also want to include the idea that inside these vessels are highly pressurized, because when the heart contracts, it increases the pressure. So not only are all these things going on, but you're also throwing pressure and resistance and force to it as well. Again, just to kind of illustrate what's going on in the circulation system. Again, I want to piggyback on the idea of oxygen being a huge component of health and remind people that when our body makes energy, we eat food, it converts it into glucose, and glucose is ultimately converted into ATP, and ATP is the actual energy form for the body. So every metabolic process in the body uses ATP without exception, and that's, again, the main currency of the body. And again, going back to oxygen, you need oxygen to make ATP. So that's, again, why oxygen is so important, is oxygen what determines that. Again, actually, if you don't have oxygen present, you make 2 ATP for every unit, versus when you do have oxygen, you make 32 units of ATP. So oxygen has the ability to 16-fold the energy production for the same amount of precursor input, which is really important. And I have the analogy here of, if you have a car with 700 horsepower and a car with 100 horsepower, which one do you think is going to do better? Obviously, you want to be the 700 horsepower car, and your circulation system plays a major role in that. I also want to talk about, if the circulation system provides the resources, how do you feel when you haven't eaten for a couple of days? Obviously, you don't feel good. Again, your tissue and your cells are the same. Again, the idea of being able to go to the doctor when you feel sick, the circulation system is where the immune system comes from, which is typically how the body heals itself. So again, if you have impaired circulation, you have impaired doctor visits, to kind of use that analogy. And then again, also the immune system also protects you besides healing you. So I want to use the analogy of 911 here. So most people agree being able to call 911 and have the police come is in their best interest, and it's necessary, and we appreciate what they do, obviously. So I want to say that when you have impaired circulation, the cell's ability to call 911 when they need help is also impaired. So I think those are some tangible examples to kind of further drive that point home of why circulation is so important, and why when circulation doesn't work, it's even more of a problem. So again, this is what the circulation system does, just so we're all on the same page. So again, that's the circulation system in a nutshell, just so we have a basic idea of what it is, why it's so important, and what it does. So now kind of going into the disease component of things, I want to kind of give some basic examples, and we're going to elaborate on these. So these are the contributing factors to why cardiovascular disease is so dangerous. So the first one would be hypertension, which is elevated pressure. So imagine you have a system or a tube or a bag, whatever it is, and you blow it up, and now it's always under pressure. There's a lot of examples where when something's constantly under pressure, it causes it to break. So imagine a system that's increasing pressure, decreasing pressure, increasing pressure, decreasing pressure, and it's doing that literally 100,000 times a day, 24/7. That's going to cause a problem eventually. At the same time, we talked about how the blood vessels are very sensitive. So we have the microvasculature, which is the small ones, and the macrovascular, which are the big ones. They're both very sensitive. And when the pressure becomes too high, it can damage those. So imagine punching a hole in a blood vessel, causing a tear in the blood vessel, causing damage to the blood vessel. Pressure is definitely the number one cause of that. I think that's something to intuitively understand. And so now the hope is that you understand all the good things that circulation system does. And we talk about blood pressure or pressure being the number one factor that damages it. You can intuitively, again, begin to understand why measuring your blood pressure is so important. Because when the blood pressure is elevated, it's going to cause damage. And now we can understand what that damage is and why it's so important or so impactful. The second point we're going to elaborate on here is what's called atherosclerosis. Again, this is a fancy term for deposits or buildups in the arteries typically, or the blood vessels. I want to include here the atherosclerosis. These plaques are typically made up of lipids or fats, immune cells, and inflammation that occurs in the endothelial lining. Again, the lining. So again, when we have high blood pressure, it's going to damage the exterior of the vessel or the lining. And then when that becomes damaged, it makes these lipids and immune cells bind, get stuck, and cause secondary problems. These plaques or blockages can restrict blood flow, which obviously is not a good thing. Our cells need nutrients and they need that waste to be taken away. And when we restrict blood flow, that doesn't happen. I also want to include the idea that cholesterol is one of the main drivers of this, so LDL. So again, we're talking about plaques, restricted blood flow, damaging blood vessels. LDL is a major driver for that. It's the main fat that gets stuck or embedded in that endothelial lining, cause all these other problems. Again, like we were saying here, including endothelial dysfunction. So the example here is when you have endothelial dysfunction, a very loose example is imagine a freeway with no exits. So all of a sudden you cannot exchange things in and out. It can't do its full job. You're limited in capacity and you can no longer distribute or transport those resources the body needs. And then I also want to include the idea of remodeling or vascular remodeling. So when there's a problem, the body has to work around it. It can't fix it, but it works around it. And oftentimes that remodeling results in a bigger problem or issue later down the road. So I think, again, that's important. So I know it's a lot of information, but again, the big takeaway so far for those of you that are just joining us is that cardiovascular disease is not only the number one cause of death, but it's a major risk factor for basically 6 of the 10 other most common causes, or 7 of the other 10 most common causes. And when you talk to people in the population, most people don't measure their blood pressure, they don't exercise, and they don't know their LDL, which we're talking about are the major driving factors of that. And so if there's a very simple, powerful change you can make in your life, it's typically going to involve cardiovascular function, which is why exercise and measuring blood pressure is so important, which goes into this slide right here perfectly, which is the number one thing you can do to prevent all of this. And by the way, it's free, is measure your blood pressure. So again, it's generally the number one cause of damage to the cardiovascular system is excess pressure, which is why we want to measure it. And yet most people don't. And again, when I say free, I mean, it's a little loose. You have to spend $35 or $40 to get a blood pressure monitor. But once you have it, it's free to use. It's very simple. And so I think when I was doing this presentation, I was preparing for it, one of the things that came to mind is in marketing, psychology, and life, there is a concept, which is that people associate the value of something for the price. So part of why people think a Ferrari is so cool is it costs $300,000. And part of why people who don't think a car that costs $1,000 is very cool because it only costs $1,000. So a lot of times we associate the value or the importance with cost or value, price. So I think perhaps what's going on here is that because you don't pay to measure your blood pressure, there's no cost, people don't associate a value with it. Again, I don't personally understand why people don't measure their blood pressure. That's why we're talking about it today. But I think this is an important thing is that I think people psychologically, because they're not paying for it, they don't think it has a lot of value. And unfortunately, as we're talking about today, it's probably the single most important thing you can do for your health. It is literally a free intervention that could potentially save or change your life, yet nobody does it. So I think, again, that's the biggest takeaway from today. It's literally something you can do at home, whenever you want. It's nearly free, it takes 45 seconds, and it can save or change your life. There's almost nothing else in this world that can make that claim. To give some examples to illustrate that point is that I'm going to actually jump ahead here real quick. I'll go back. So again, in blood pressure, we have the top number, which is the systolic. That's when the heart contracts. That's the highest amount of pressure. And then we have the bottom number, which is the diastolic. That's when the heart relaxes. That's the lowest pressure. The reason why I say that real quick is that for every 10 points, the systolic or the top number increases, it could potentially increase the risk of a stroke by about 40%. Technically, I read that wrong. It reduces it, but the numbers are basically inverse at that point. So for every 10 points, you can reduce your systolic, you can reduce the risk of stroke by 40%. And again, let's remind ourselves there's 140,000 deaths a year due to stroke. It's like the number 6 or number 7 cause of death. So just lowering your blood pressure by 10 points reduces the number 6 cause of death by 40%. That's a very major benefit or value. I want to include next that for every 20 points, the top number increases. So we're going from 120 to 140. It's going to double the risk of cardiovascular disease, which again is the number 1 cause of death and basically drives every other cause of death as well. That's a huge increase. If you could double the risk of death or prevent a doubling of the risk of death or the number one cause of death, I think we can all intuitively understand that's a huge benefit or gain. And then I also want to include here that there's increased risk of dementia, which I believe was the number 7 cause of death, number 5 cause of death, I don't have that memorized, by 20 to 30% per 10 millimeters of mercury. So again, if you go from 130 to 140, you could be increasing the risk of dementia by more than 10%. So there's so many things that blood pressure is affecting. Yet again, when we go into the population, people aren't doing this. So I have at the bottom here, 120 versus 130 versus 140, who cares? Well, it turns out going from something like 120 to 140 can result in anywhere from a 10 to 50% increase risk of 5 of the most common causes of death. There is probably nothing else in this world that has more of an impact on your health than cardiovascular disease and high blood pressure. And there's probably nothing else in this world that you have more control over than your blood pressure and cardiovascular disease, which is again why we're talking about today. And hopefully people are beginning to see the need, value, and benefit for doing this. Again, talking about the why, this is the why. And again, we already kind of mentioned the reward is living longer, higher quality of life, having more energy, being more productive, and all the things that go along with that. So I think that's a really important point for people to be mindful of. Okay. So we're going to talk about real quick, how often should we measure our blood pressure and what is the goal? Personally, I typically see Omron is the brand recommended for blood pressure monitors. I always tell people, if you remember the name Omar and you see Omron, it'll be the same. So you can just use Omar as how to remember it. The Omron 3 is only like $35 to $40, so it's pretty inexpensive. Again, going back to that free part, it works really well. So for anyone who's 30 and up, you should be measuring your blood pressure at least once a month at home. There's a lot of information that shows that cardiovascular disease can start in your 20s and definitely your 30s. So definitely 30 plus is a good time to be monitoring that, especially for diabetes happening earlier and earlier and things like that. For anyone that's 50 and up, definitely once a week. You're definitely into that moderate risk factor age group. We need to know what's going on. And for anyone who's 50 or older and has serious health issues, I would recommend something like 2 or 3 times a week. If you have heart failure, a risk of stroke, really bad cardiovascular disease, kidney issue, liver issue, whatever it may be, definitely at least twice a week is where you want to be at. The next question I always get asked is, when should I measure my blood pressure? I think the most important answer here is be consistent. The reason why I say it is your blood pressure does kind of oscillate throughout the day. It typically is a bit lower in the morning, a little bit higher in the evening. So if you measure one day in the morning and the next day in the evening, you compare them, they're going to be lopsided. So I think the easiest way to do this is be consistent. Apples to apples, oranges to oranges, morning to morning, evening to evening. It's the easiest way to kind of pull out that bias in the data. What I personally recommend is keeping the monitor somewhere where you relax. For me, it's where I watch TV. So once or twice a week when I'm watching TV in the evening, I'm nice and calm, I'm nice and relaxed. So my blood pressure is where it normally would be. I'm just going to bend over, grab my monitor, put on my strap, push the button, watch TV for 45 seconds, look down, see the reading, make a mental note of it, take it off, put it away. It literally takes 90 seconds. It doesn't cost me any money, doesn't really cost me any time, and it could potentially save or change my life, just to kind of illustrate that point again. So I think that's an important point. For people who are worried about their monitors not being accurate, the common recommendation is just bring it into your doctor at the next visit. They'll measure your blood pressure with their device, and you can measure it with yours and kind of compare them and get an idea. So it's a really easy way to do that. We already talked about blood pressure again, where the top number is systolic. That's when the heart contracts. That's where all the pressure comes from. And the diastolic is the bottom number. That's when the vessels relax. That's where the lowest pressure is. So we look at the high and the low, and we want to have a range. What is that range? So currently, the guideline just changed last year. The current guideline right now is, regardless of age, everyone should be a 130 over 80 or less. Typically, 120 over 80 is still the gold standard. So that's definitely still true, hasn't changed. And I also want to include here that almost always when you talk to athletes, they have the same blood pressure, which is typically 110 to 115 over 60 to 65. So you definitely see that massive impact of exercise. A lot of patients that have cardiovascular disease issues, a blood pressure of 160 over 90 is very common. And now compare that to someone that's 110 over 60. It's a massive difference. And the big driver there typically is going to be exercise. So we're talking about doing 2, 3, 4, 5, 6 hours a week of cardio, whether it's running, cycling, swimming, or all of the above. That is definitely still one of the best ways to lower your blood pressure. And when I talk to patients and they tell me what their blood pressure is, I can usually tell if they're an athlete from the values, usually cyclist, just anecdotally. Most often when I talk to patients and they tell me their blood pressure is like 110/60, unless they are, some older person who's really small and little, they're going to be an athlete. And then typically they have heart rate of 60, which again implies the heart is very efficient. The muscles are nice and strong. They don't have to work as hard, which is, again, the longevity component of it. We'll talk about that later. In terms of when to pay attention, 140/90 is considered the diagnosis for hypertension. So once you reach or exceed that, you definitely need to pay attention. And if you have elevated values of 140/90 for more than a couple of weeks, definitely need to go see the doctor. Anytime the top number is over 150 or the bottom number is over, let's say, 90 or 95 especially, that's when you really got to start figuring things out. That's like when you need to be like, okay, this is serious. I'm going in the wrong direction. I'm concerned and I need to do something about it. I'd say 150 is definitely that point. There's no one that's going to tell you at 150 you're up, you're not at risk. It's a universal value, and you definitely need to really double down before it gets worse. Because as you can see on the slide here, once you get to a top number of 160 or a bottom number of, let's say, 95 or 100, things get serious. It's putting pressure on the kidney. It's putting pressure on the heart. It's putting pressure on the body. And you're trying to increase the risk of things like stroke and heart attack pretty significantly. And there's just a lot of negative things going on. And we definitely want to avoid that. And then again, anytime the top number is over 170 or the bottom number is over 100, there's a real risk for an event happening now. It's not something that's going to be next week or next month or next year. There's a genuine concern about right now, just to kind of provide that context. Typically, if your blood pressure is 170/100, you definitely need to call your doctor. And if you're symptomatic, which we'll talk about in the next slide, you may consider going to an urgent care or even an ER to be treated, as there is a real concern there for an acute event. And I just want to include here too, for patients that do get blood pressure over 160, there's a medication called clonidine that's highly recommended. It's an acute acting medication that you can take now to lower your blood pressure now. And it can be a really good medication to help reduce the risk of those acute events. So if your blood pressure, you measure it, it's like 165/100, you measure it again in 15 minutes, it's elevated. You can take clonidine to help get it a little bit safer and reduce the risk of something happening. Real quickly, we're going to go over, actually, I'm going to jump one ahead. And like we said, the symptoms of dangerously high blood pressure, they're somewhat non-specific, but I think they're also, pretty apparent. Definitely severe headache, chest pain, and dizziness are going to be very common. A blurred vision, and just feeling very tired, having difficulty breathing. I think those are the most common. You could also get something like nausea or vomiting, just feeling confused, or actually feeling like a palpitation or that there's something weird going on. But I would say severe headache, chest pain, dizziness, and blurred vision are definitely the biggest ones to look for. If you measure your blood pressure and it's going to be, above 170 or over 100 and you have those symptoms, just go to the ER immediately. It's not a time to be lackadaisical. That's not a time to, think about what's going on. That's a time to act. You don't want to wait. In terms of measuring your blood pressure, we first of all talked about how the same time every day is really important. Going to go into some other technique issues. So generally, they don't recommend measuring it within 30 minutes of that measure. They don't recommend measuring it within 30 minutes of eating. So that's the first one. They do recommend trying to use the bathroom beforehand. You do want to be relaxed in a chair, so nice and comfortable. And typically, you want to sit there for at least 5 minutes before you do it, so your blood pressure can lower to where it normally would be. This is why I keep mine where I watch TV, because I'm already sitting there and I've already done that. I don't have to wait for that. You want to keep both of your feet flat on the ground and definitely don't cross your legs, because when you cross them, it's going to increase the value. You do want to rest the arm the cuff is on, typically on a table. So it's going to be around, waist height, around your navel. Don't let your arm hang. Don't put your arm up in the air. It's going to bias the results. You want to make sure the cuff is tight, but not too tight, because that can throw off the values. And definitely, ideally, you don't want to put the cuff over clothing. What I like to do is I will try to put 1 or 2 fingers between my skin and the cuff. And if I can fit my fingers into the cuff, that's a way of me making sure it's not too tight or not too loose. I can fit my whole hand in there, then obviously the cuff is a little too loose. And then also mentioning you don't want to talk while you're doing this. So I think those are some really important points to be mindful of. I also want to include that the ones that go on your wrist, those don't work very well. They're inaccurate. Please don't buy those. Definitely want to buy the one that goes around the bicep. Typically, you push the button, it measures it for you. Talked about that. I also want to conclude this real quick for the sake of being complete here. Symptoms of heart attack and stroke on the next slide. Again, talk to your provider or physician for more information. This is just general educational points. Definitely not diagnosing anything here, just to be clear. But generally speaking, you're going to have chest pain, pressure, discomfort. You're going to have pain in your neck, arm, throat, or back, often on the left side, especially in the jaw area. You may feel very out of breath, very winded. You can't catch your breath. You could potentially have nausea, vomiting, or heartburn are also reported very common. People get sweating or cold sweats, so that's another thing that can occur. An uneven or very fast heart rate, because again, the heart is struggling at that point. And then also just feeling very dizzy or lightheaded. So those are kind of fairly general symptoms, which is why you want to talk to your provider for more one-on-one information. But definitely the chest pain, the radiating pain, the pain in the jawbone or the arm are very common. Having heartburn and having kind of that cold sweating sensation and feeling lightheaded or dizzy, I think you're going to get a combination of those pretty often. And like I said, we also want to talk about the symptoms of stroke. For this one, they use an acronym, which is BFAST. The reason why they pick BFAST, besides the fact the letters line up, is that typically the sooner you're seen in a hospital for a stroke, the better the outcomes. Certain medications, they cannot be used after 4 hours from the stroke occurring. So definitely you want to get to the hospital within 4 hours or less of the stroke occurring for the best treatment outcomes. You do also want to record the time you think the stroke happened, because they're going to use that to diagnose and determine when those 4 hours is up. And that may cause them to not do a therapy that's in your best interest if they can't definitively define when the stroke occurred. So the first one's going to be balance. So you're going to be dizzy, wobbling, unstable gait, or unable to walk. That's the first one. Next one is vision issues or issues in the eyes. This can be a blurred vision. Your eyes are not focusing properly. Someone's kind of like looking around and not able to focus at you when you're talking to them. The next one's going to be a droop on one side of the face typically. So you can see that the face is not really lined up. Maybe a cheek or a cheekbone or cheek area is a little bit higher or lower. Same thing in the mouth. The mouth is not straight, or when they're talking, both sides in the mouth are not moving symmetrically. Something to look for. Again, in the arm, we talked about that as a symptom of heart attack, something similar here with stroke. You can have weakness or numbness, either in one or both sides, or inability to kind of move your arms or your hands or your fingers. Could be another diagnostic. Speech being impaired is a problem, so they're kind of muddling their words. The words aren't coming out correctly. They're just kind of like mumbles in a sense. That could be an issue or a sign of this. Again, not being able to communicate, how are you feeling, what's going on, the person can't respond. That's another concern or issue. And then again, like we mentioned, time. Definitely want to go and be seen as soon as possible. And for most people, that's going to include an ambulance ride, especially if you're not able to move, walk, or no one can help you. And because time is of the essence, that's not a time to cut corners. Next thing we want to talk about, and again, for those people who are joining us live, we're talking about cardiovascular disease as it pertains to health, wellness, diabetes, and all of the above. Again, it's not only the number one cause of death, but it also drives 7 or 8 of the top 10 causes of death. Yet most people are not properly treating it. So we're really talking about that and giving some examples. Right now, we're talking about blood pressure still. So we talked about what blood pressure is, how to measure it, what's high, what's low, what it can cause, what the symptoms are. Now we're going to talk about what really causes it to be increased. I personally think this information is a little general, and that's kind of why people get confused here. I generally find myself explaining to people as happy and healthy. So if you're happy and healthy, what does that mean? That means you have plenty of energy, you look good, you feel good, you have a healthy diet, you can go run a couple miles, go lift weights at the gym, you can go hike up a hill for a half hour, you can do all these things. And if you can do those things or you're doing those things, you're happy and healthy, cardiovascular system is probably going to agree with you on that one. You'll see a lot of these things fit in with that. So in terms of the risk factors or the things that cause it, again, the first one is going to be age, and that's because the arteries harden as we age. We talked about how there's a lot of pressure in the arteries. Pressure goes up, it goes down, it causes them to contract and go like this. And if they get hard, they can't do that. And when something is pressure is put on it and it can't expand, pressure increases more. So that's the first one. There's a lot of genetic components, which we're not really going to get into, but that definitely can play a role. Next one is BMI, which would be your weight. So if you're curious what your BMI is, just Google BMI calculator, put your height, weight, and gender, and it tells you what it is. Typically over 30 is considered overweight, and over 35 or 40 is morbidly obese. The reason why this matters is that as you weigh more, there's more cells that need blood. Going back to that circulation example. So if I gain 20 pounds, that's 20 more pounds my body has to feed, provide blood to, increase the amount of work. So that's a main reason why BMI can be a driver here. A sedentary lifestyle, like we kind of already said, but in this case, it turns out when you don't exercise, it can cause your vessels to stiffen. So again, if they can't flex, the pressure goes up when the pressure increases because the volume can't expand. And also it increases the heart rate. So again, going back to the example of those cyclists I was talking about, they have heart rates of 60. That's not a coincidence. They have very strong, effective hearts, which makes the heart more efficient. It has to beat less often. And the opposite is true here. If you don't exercise, the heart muscles become weaker. They have to beat more because they're not as strong. Increases the heart rate. Diet definitely plays a role. We're going to talk about that more with atherosclerosis. But the example for blood pressure is that typically processed foods, especially those that contain salt, are shown or linked with increase in blood pressure. And that's because salt will cause us to retain fluid, and that will increase the volume, which increases the blood pressure. So the DASH diet, it's a common term you hear there. Next one's going to be alcohol and tobacco, both of which damage the vessels and the lining, mainly tobacco for damaging the vessels. The alcohol affects the liver and the blood contents, the fluid contents, all those things, so it definitely increases it. Stress, as I think most people understand, can affect blood pressure. It can increase the cortisol, which itself regulates the body, and part of that is increase in the sympathetic nervous system, which in response to that constricts the blood vessels, because that's what happens when you increase sympathetic. We're not going to go into that, but obviously if you have a smaller blood vessel, you're going to increase the pressure. Also want to include here a really important point that I think a lot of people sleep on, pun intended, is sleep apnea. So it turns out sleep apnea is one of the leading risk factors for cardiovascular disease by anywhere from 30% to threefold increased risk. The reason why I really want to mention this is that there are a lot of people with sleep apnea that don't know it or they're not treated properly. So you can see here on the slide, there's about 6 million people who have been diagnosed, but potentially as many as 30 million who are affected. So we're talking about 10, 20, 15 million people who have a risk factor for cardiovascular disease that are not treating properly. And we're talking about potentially increasing the risk factor by 3. So again, sleep apnea is definitely very serious. It's something to be mindful of. I definitely encourage everyone to talk to their doctor about it to see if it's something that may affect them and to get a sleep study done to better understand that. Also want to include a statistic here that a study found that more than half of the people over 65 are at risk for sleep apnea. So definitely something that's very prevalent, especially as we get older. So again, I think those are the things that drive blood pressure. And I talked about the idea of happy and healthy. And kind of what I want to say with that next is that my personal feeling is that people feel like as long as they don't do anything bad, their health remains good. So I don't drink excessively. I don't smoke excessively. I don't eat fast food excessively. I exercise every once in a while. I do enough, and that should be enough to remain good. And unfortunately, it just does not work like that. You need to actively work on your health to even maintain your health, let alone improve it. And if you're not actively spending time, money, and energy on your health, most likely it's going in the wrong direction. And I think that's a point that people really misinterpret. I think this is a good slide to show that, because BMI, being sedentary, having a bad diet, drinking alcohol, not managing your stress, all of those things by themselves, they may seem kind of neutral. Okay, I'm a little overweight, who cares? Okay, I don't go exercise every day, who cares? Yeah, I eat fast food every once in a while, or processed food, who cares? I drink every once in a while, who cares? Well, unfortunately, these things all add up, and people may not understand that although they're not doing them excessively, and they may not demonstrate like a real risk to their health today, they're definitely doing something. So again, if you're not actively doing something to build or maintain your health, there's a good chance it's going to get worse. And that ultimately, as you can see on the slide, a lot of what increases blood pressure, which again is the number one risk factor for not only the number one cause of death, but most of the other top causes of death, is that it is based off aging and lifestyle. So if we're not properly maintaining our lifestyle, especially as we age, there's a lot of risk that we're taking that doesn't need to occur. Also want to just kind of give the flip side of that is what decreases blood pressure. You could basically imagine it's the opposite of what I just said, but I have some examples here. So again, eating a well-balanced diet, especially one that's low in salt, can lower by 2 to 5 points on your systolic blood pressure. Alcohol has been shown to raise up your blood pressure by as much as 5 to 7. Regular exercise can lower your blood pressure by 5 to 10. Managing stress or having excess stress can raise it by your blood pressure by 5 to 10. And then another really important one is your weight. So for every kilogram you gain or lose, which is about 2 pounds, it can affect your blood pressure by 1 point. So if you went from 205 pounds to 185 pounds, you could expect to lower your blood pressure by as much as 10 points, which is a lot. Smoking can increase it by up to 5, but I also want to include that most of the damage from smoking is not blood pressure, but endothelial damage. So there's a lot more going on there besides just those 5 points. And also things like not taking medication properly, so skipping doses, not going to the doctor, and having the proper medications. And then again, like I said, working with your healthcare professional to make sure you're doing all the things you should be doing. So I know all those things seem simple. The change of the difference is fairly minimal. Typically they're between 2 and 5 or 5 to 10. But I think a really interesting point is that if I add up all those things on that list, which are again, all things you can do on a daily basis. So you eat food every day, you could or cannot drink alcohol every day, you could exercise every day, obviously you have stress every day, you gain or lose weight on a daily basis, you smoke on a daily basis, take medications on a daily basis is my point. If you do all those things, it could be anywhere from basically 30 to 40 milligrams of mercury on your blood pressure, which is a lot. And again, maybe all these things aren't additive, but we're just trying to use some examples here. So that could be going from potentially 160 to 120. That could be going from 160 to 130. That could be going from 150 to 120 or 130. So trying to illustrate here that these simple changes that often require very little to no money, very little to no time, can literally change your life, because these things alone can cause, drive, or affect the number one cause of death, which I think is a very, very powerful concept. So I think this slide maybe is the most powerful slide for today. The most powerful concept is that if you can improve your diet, reduce your alcohol intake or cut it out entirely, reduce your tobacco intake or cut it out entirely, do a little bit of exercise, work on your stress a little bit, and take your medications properly, and basically not gain excessive amount of weight, you could potentially almost in its entirety reduce the risk of becoming hypertensive or having high blood pressure. Because like I said, 30 to 40 points is a lot. And so you could go from 160 to 140, 160 to 130, so on and so forth. This is the roadmap right here. This is where it all comes down to in terms of make or break it, success, happy, healthy, whatever it may be. A lot of it's right here. It's simple, small changes that you do on a daily basis that will change your life. If you do these things every single day and you lower your blood pressure by 20 or 30 points, I guarantee you it will change your life. You'll have more energy, you'll feel better, you'll probably look better, you'll have more confidence, you'll be more productive, you'll have a happier and healthier life. It's that simple. It's these things right here that you need to do. And I think that's what people don't understand is they want to look for that 1 in 1,000. They want to look for that pill. They don't want to realize that it's just a few simple changes that they can do that will change and save their life. So again, I just want to finish this slide with saying only one of these requires extra time, which would be the exercise. Basically, all these other things, they don't require any time, often money, or even energy to do. They're just simple decisions. So we are hitting the hour mark here. So if you've been watching the whole thing, I appreciate that. I know we're getting a little long-winded here, but like I said, this is a very important topic. It's probably the single biggest topic when it comes to health. And I've been really coming across a lot of people lately who don't fully understand that or don't make their lifestyles match that. So I want to include it. We're going to try to start wrapping it up here. We're going to talk about the number 2 cause or component of cardiovascular disease, which is plaque buildup, which is technically called atherosclerosis. This is basically a blockage in the vessels that produces the flow, but it can also cause an occlusion, which would be a form of a stroke, or a rupture, which can also cause a stroke. So again, it has a very major role because it determines how the blood flows and if it flows. I want to start off with a very interesting point was when they did a study and they looked at people who were 18 to 34, they found 100% of all those people had some amount of atherosclerosis. So I want to mention too that it's a natural process. People say, oh, I'm happy, I'm healthy, I don't eat fast food, I exercise, I don't have to worry about it. Well, unfortunately, it doesn't quite work like that, because even people who are 18 years old who haven't had time to have bad habits, they have these issues. So my point here is it's naturally occurring, which means it's something we all have to be worried about. In terms of some causes of atherosclerosis damage, again, the first one's going to be endothelial dysfunction. So when the endothelial lining has a problem, everything else suffers. When you have a bunch of plaque and whatnot built up on it, it damages it. So again, dyslipidemia is basically lipids or fats. So when your cholesterol goes above 150, that begins to cause or increase the risk of atherosclerosis. This then causes an accumulation of fat in the arteries and the blood vessels. And the problem there is that when that happens, the immune system, which we already know is a major component of the blood, it gets involved. It tries to fix and get rid of that fat, and that causes a foam cell. So you basically have a clump of immune cells with a bunch of fat in them. They get stuck, and that can form a plaque. So you have, again, the body doing what it does, and then you have excess concentration of fats, which recruits the immune system, and they try to fix it, but it makes it worse. So again, an example of remodeling can be a short-term solution with long-term consequences. Talked about that earlier. There's also examples of these foam cells. Again, these fat immune cells can cause mitochondrial problems, so you don't make as much energy. They can basically damage the cells and cause them to even die. It can cause them to increase inflammation and all these other problems. So there's a lot going on with just fat deposits and the body trying to fix that but not being able to, which again then causes increased inflammation, which brings more things in. So oftentimes in health and in biology, things are cyclical or exponential. This is a great example. Maybe you get one molecule of fat, which recruits 2 molecules of immune system, which causes 2 foam cells, which then makes 2 molecules of fat get stuck, which recruits 5 immune cells. And before you know it, you have hundreds or thousands of cells where it just start off with 1. It's exponential because of the nature of how this works. And a lot of it is just endothelial dysfunction, fat accumulation that the immune cells get caught up into, which then promotes a lot of inflammation, which is bad for everything. Also want to talk about that atherosclerosis does increase the risk for high blood pressure because, again, the vessels can't expand or contract, which further damages the endothelial linings. And then examples of diabetes. Diabetes can also be made worse by atherosclerosis in terms of the damage to the blood vessels. So all those things kind of come together. So again, the accumulation of things in the circulatory system becomes a problem. It causes it not to work well, and that can cause problems with diabetes, problems with blood pressure, cardiovascular disease, so on and so forth. It's a pretty long list. So a common question we're going to get obviously is how do we prevent this? So as I've shared in prior conversations, things like blood pressure, diabetes risk, your A1C, getting that measured once or twice a year plays a major role. Knowing your LDL and making sure your LDL is a goal plays a major role because we just talked about how the cholesterol or the LDL is where these foam cells come from, these deposits. And then also BMI, because typically when you're overweight, it's a risk factor for these things. There's also some type of dietary issue going on that plays a role there, as well as being overweight increases the risk for high blood pressure, which we just showed is at risk for atherosclerosis. Again, to kind of tie everything together, when the body's happy and healthy, these things aren't going to happen. When you're happy and healthy, your blood pressure is good, you're not diabetic, your cholesterol is not super high, and your BMI is definitely not super high, typically because you're burning calories. So if you're happy and healthy, it's going to check all these boxes. In terms of preventing it, a common thing we'll hear it said is statins, cholesterol medications, simvastatin, rosuvastatin, those types of drugs. And I want to make a statement here real quick that basically, when you look at the literature, statins are very effective and very safe. I'm not going to go into the details, but there's very little to no evidence they cause memory issues. There's very little to no evidence they increase the risk of diabetes. They don't cause kidney issues. They don't cause cataract issues. Generally speaking, statins are very well tolerated. In terms of medications, they are by far the number one way to prevent atherosclerosis. And again, this is where I get that example of you're worried about a 1 in 1,000 side effect over a 1 in 10 side effect. If atherosclerosis drives the number one cause of death, that's a 1 in 10 risk. If there's a small, very minor chance that the statin may cause a side effect, a 1 in 1,000 risk, I would much rather avoid a 1 in 5 or 1 in 10 risk than be focused on a 1 in 1,000 risk, just to kind of tie that back in there. But the real thing that I want to communicate here is that there is no very effective atherosclerosis treatment. And commonly when you look in the literature, they talk about treatments as partially reversible, but you never see the term reversible. And that's because once you have these foam cells, again, these clusters of immune cells they've basically digested the fat, that foam cell, it's very hard to get rid of it. When you have those fatty streaks or those plaques in arteries, it's very hard to get rid of it. So again, we need to be proactive. We need to start today. We definitely do not wait for symptoms to occur, because by the time those symptoms have occurred, it's very hard to treat it, and oftentimes we can't reverse it. Some examples of why that point is true is when you look in the literature, they found that statins typically reduce the volume or the size of those plaques by about 10% or less, which is definitely not 100%. So you're definitely not going to take a medication and get rid of all your plaques. They'll get smaller, they'll get more stable, but they're not going to go away. Another study showed that diet can potentially reduce the size of the plaque by about 8% over 1 year. So again, not going to get rid of all of it. So even if you did statins and diet, probably at best you're looking at a 20 to 30% reduction in the amount of plaques you have, which is why they call it partially reversible, but definitely not reversible, which is why you need to do things now. Some other ways to prevent this is increasing your exercise and anything that damages the endothelial lining, which we already talked about, reducing that. Those are some really important topics. Again, you have to be preventative because you're not really able to fix this once you have it. And at the same time, I want to make the point that we've talked about some prior presentations, talks, videos, that most things you can do, whether it's diet, exercise, BMI, lowering your blood sugar, they have about a 10 to 40% reduction in the risk of atherosclerosis. So when we're preventative, we have a 10 to 40% ability to reduce this from happening. But when we talk about statins and diet, at best, it's a 10% reduction. So again, I'm trying to illustrate that prevention is going to be infinitely more effective than treatment once you have it, which is why we need to do this. And again, the idea that this is not a disease that you're going to be able to successfully treat once you have it. You can prevent it from getting worse and hopefully prevent it from being a problem, but you definitely will not get rid of it, which is why you need to understand that you cannot readily reverse this. You need to stop having a wait and see attitude. You need to do something now. And again, the reason why you need to do something now is because it's also silent. So we didn't talk about this yet, but cardiovascular disease is considered a silent disease. It's typically not symptomatic. And typically when it is symptomatic, it's at moderate or severe severity, and it's difficult to reverse, like we talked about prior. So you need to get rid of this stop and wait and see type attitude. Health doesn't work like that. So I think that's a really important concept. So we're about to wrap things up here. Again, I just want to make sure we went through all these points. But basically, you need to be happy and healthy, have low blood pressure, exercise, not become diabetic. And those are going to be some of the best ways to prevent atherosclerosis. Get your labs done. And if you need to take a statin medication, take a statin medication. So that's basically the information I have today. I know that was a lot of information. I know we just eclipsed the hour mark here. So for those of you who watched the entire video, I really appreciate it. Again, there's probably not a bigger concept that will affect your health, your well-being, your life more than this, which is why we're talking about it. At the same time, in my experience, most patients I interact with aren't proactively managing this, which is why we're devoting this entire time today to talking about this. We really only have 1 or 2 subjects here because we really want to get into the details, give lots of examples, and help people understand the why and the reward, like we said in the beginning. So just to kind of finish here, on a point here, that health should never be a wait and see subject or attitude. Because by the time we have things, we're going to be partially reversing them at best. And typically by the time we know it or we have symptoms, it's already progressed to being moderate or severe. And it's very difficult to treat at that point. Versus if we start today, we never have that issue, it's a lot easier. But unfortunately, that's how people view health. People always have a wait and see mentality with health. And we just need to get rid of that. We need to be focused on our health today. We need to be involved and invest in our health today, because by the time we have a problem, it's going to be hard to treat it. Instead of this idea of only beginning to do something when you have symptoms, because it's already too late oftentimes. And the example here is that cardiovascular disease is difficult to reverse. And atherosclerosis, oftentimes at best, is only partially reversible. So not only is it difficult, but oftentimes you can't fully undo the damage. And again, we're talking about the number 1 cause of death, being difficult to undo the damage and difficult to reverse it once we have it. So why take that chance? And again, the idea that not only is it the number one cause of death, but it basically drives 7 of the other 9 items in the top 10 list. So again, my question for you, part of my closing here, is that why are we having this mentality of only treat until you have symptoms? Well, it's most likely because people aren't fully aware. They don't have optimal health literacy, which is why we're here today. I think this is a very clear topic that I think almost everybody can understand and apply to their lives. I think the why is very clear. I think the reward is very clear. It's preventing death. It's preventing strokes. It's preventing heart attacks. It's preventing complications from diabetes. It's preventing you being on a couch for 10 to 20 years. It's preventing you from not being able to go to work, do your hobbies, play with your kids, play with your grandchildren. That's what we're talking about. There are very few, if nothing else, that is going to impact your life more than this. And I'm trying to help people understand the why and the reward to that, because I think that's what's missing. And hopefully I explain it in a way that's simpler, that I used analogies, I repeated it, I connected to things in your life to help you really walk away from this video understanding that this is a problem that I need to be better on. And you're not alone. I'm not here to make you feel bad. The goal is to have a better tomorrow, not to make you feel bad about yesterday, just to be clear on that one. The goal is never to make people feel bad, because things typically don't get better when you do that. The goal is to help people understand, to empower people, to give them the why, to give them reward, and to work with them through education and lifestyle modifications typically to achieve those things. So last thing I'll say here is, would you rather give up little bits here and there versus a lot more later? So if you don't make these changes and you have these issues, say goodbye to your hamburgers, say goodbye to your steaks, say goodbye to your pastas, your desserts, your alcohol, your drinking when you want to go have fun. All of a sudden, you may not be able to do those things. I have a family friend. He can eat very little because of his heart issues. He has a very controlled, probably not very fun diet. And, I feel bad for him. And that would be an example of, if you wait until too long, you got to think of a why. Versus what we're talking about being preventative, we're talking about maybe eating a little bit less steak, maybe drinking a little bit less alcohol, maybe exercising a little bit more. We're not asking you to make black or white, 100% life, not life or death, but life-changing decisions, life-altering decisions. We're just saying a little tweak here, a little tweak here, a little tweak there, prevent a whole lot of tweak down the road. And I think you're better off that way. So again, if you want to enjoy your life and be able to do the things you want to do for the rest of your life, you need to start now. The longer you wait, the more freedom you risk giving up later. I think that's a really powerful concept people don't understand. So thank you for listening. I know it's a lot of information. If you have any questions, feel free to put those in the comments below. I can also be reached at welcome@yourpersonalpharmacy.net. If you like this information, check out other videos. This is our 6th or 7th video along diabetes. Please also subscribe to the channel. If you have any other questions, like I said, email me. If you're looking for supplements, we have a really cool supplement store on our website, which is yourpersonalpharmacy.net. Just click the shop tab. We have all the best brands and all the best products. And I can also work with you individually to help you understand which is the best product for you. So again, please take this information to heart, think about it, and really make some lifestyle changes today, because this is a really important topic and most people I'm talking to aren't properly optimized. Again, my name is Chris. I am a biochemist and a pharmacist. I'm the helpful pharmacist. Thank you and have a great day.